Hi, it's Dr. Susan, and I wanted to talk to you about some common questions that patients ask me about vaginoplasty. First of all, what is a vaginoplasty? You know, a plasty is just a tightening of anything. We can tighten with the tummy with an abdominoplasty or any part of our body. So a vaginoplasty is tightening the vagina, usually for purposes of increased sexual satisfaction. So many of us who've had vaginal deliveries, in fact, all of us, I've had one vaginal delivery and I've experienced this myself, experience some vaginal relaxation. You know, when we push a baby through the vagina, it just does not go back to how it was before. And when we've had 3 or 4 children especially, the vagina can become quite relaxed so that we don't develop that friction that we want that gives us sexual satisfaction. So frequently patients will come and see me complaining of just not being able to feel as much with intercourse due to this laxity. And it's nobody's fault. This is a normal thing that happens. So yes, it's absolutely normal, but is it optimal? Well, no, not for good sex. It's not. We want to have that friction so that we can feel more inside the vagina. So a vaginoplasty is surgically tightening the vagina, and the way that's done, in brief, first of all, we put you to sleep because we don't want you to have any pain. This is a surgery that's done under anesthesia. I operate at MD Aesthetic Surgery Center, which is right in the same building as my office at 1200 Benz. You would come in for the surgery, go off for a very peaceful sleep. During that time, the first step is recreating an episiotomy line. So you're going to feel stitches on the outside, kind of like when you had an episiotomy. The difference is that instead of just a line, we're actually taking out a wedge of tissue and pulling it back together. So you can imagine that the vagina, instead of being this diameter, now is a little bit tighter. In addition, an incision is made all the way up the back of the vagina, sometimes all the way up the front. By that I mean the part that supports the bladder, closer to your tummy. That could be the case if you've got a little bit of a bladder prolapse. That's not the case for every patient. In any case, we find those muscles, the pelvic floor muscles that used to support that nice tight vagina, and then just pull them back together with some very deep sutures. So in the end point, instead of the vagina being like this, with a little bit of a hole in the ceiling, a little bit of a hole in the floor, now that hole is fixed, and now the vagina is tighter. So you can imagine how that can give us some more friction with intercourse. Now, in addition, if you do have a little bit of weakness on the anterior side, remember that side that supports the bladder, that's also going to help support the bladder so that you don't leak urine when you cough or sneeze or jump or exercise, and that can be an amazing quality of life improvement. Now, in addition, we can also do that with platelet-rich plasma in addition. And we can talk more about that in other videos when you look at some of my talks that I've done about the O-shot, which is platelet-rich plasma injected into the clitoris. So frequently I'll do that at the same time as a vaginoplasty. So come see me if we have a consultation about vaginoplasty. I'll spend an hour with you and go through this in detail with you. It's not for everyone. I might tell you that a non-surgical approach is better, like a laser or something else. But let's talk about it. There's other treatments as well, like pelvic physical therapy, but vaginoplasty is a very good option for women with vaginal relaxation from childbirth because we want you to restore your best sex life just like it was before you had kids. And that can be done, so come talk to me about it. We'd love to see you here at Complete Midlife Wellness Center.